Hi everyone, Adrian Johns here from Coastal Front with another update for you. Now, unfortunately, it looks like April Fools came a little early for us today, and I wish it was a joke, but it's not. Today, the BC government, at the hands of Premier John Horgan, Adrian Dix, Minister of Health, and of course, the Public Health Officer for our province, Dr. Bonnie Henry, announced what they titled a 3-week circuit breaker to bend the curve and protect people again. Now, these latest restrictions come at a time when British Columbians are starting to feel optimistic about 2021 and looking forward to getting back into a life of normalcy. Instead, they're imposing the following restrictions. Restaurant, bars, pubs, and food services must only provide takeout and delivery service. No more in-dining services, completely prohibited, except if you're an outdoor patio. Adult group fitness activities of all kinds are completely canceled. And as previously announced, they are now no longer allowing any indoor worshiping services. Those have been suspended. Of course, travel continues to be limited to essential travel only, and Whistler Blackcomb Ski Resort is now closed down, whatever that means. All these new measures come into place tonight at midnight and are in effect till April the 19th, but we know how the government has a history of stringing us along and making us think like the end is just around the corner. So what's driving these latest restrictions? Well, Adrian Dix is quoted as saying, as a result of rising case levels, possible new variants of COVID-19, increased transmission, which is basically the same as rising case levels, and an increase in more severe cases, whatever that means, are the reasons. What's most noticeable about these justifications are the items that you don't hear about anymore. Remember back a year, 9 months ago, 6 months ago, when the government kept talking about the reasons they were imposing these COVID-19 restrictions? Reasons like people weren't wearing masks enough, or there was too much pressure on our healthcare system. We had a scarcity of ventilators and rising deaths. Well, it's funny how these restrictions haven't improved, but the reasons to have them in place continue to change. It's like changing rules in the middle of a hockey game or a soccer game. This leads me to the next big frustration that British Columbians have had with both their federal and provincial government. Decisions that are largely based around a feeling and not empirical evidence. Let me give you 3 examples. First of all, adult team sports. Soccer, hockey, basketball, baseball. These were all canceled back in December 2nd. I play hockey with a bunch of boys. Hey boys. Since then, we've never had a chance to play. We've never heard from the government as to how many people got COVID or transmitted COVID during these adult team sports. Yet my kids were able to play ice hockey. I was fortunate enough to be on the ice all season coaching my 7-year-old, who apparently is a lot more responsible than adults. Next up, Whistler Blackcomb Ski Resort. How many cases were occurring in Whistler to justify the shutdown? Knowing this number might be helpful in needing to know what the number has to drop to in order to open Whistler back up. By the way, I hear a lot of people are going to be heading to the local mountains now. See how that's going to pan out. And finally, restaurants. This is a major employer here in British Columbia and a massive contributor to our taxation system. The last and only other time that our province restricted indoor dining was back in March 20th of 2020, just over a year ago, when cases, hospitalizations, and deaths, all the things they used to talk about, were rising sharply, and we knew nothing about the virus. It's worth noting it took the province 60 days to lift those restrictions last time. So kids, forget about this 3-week only program. It's going to be much longer than that. As far as I'm concerned, this BC government would gain a lot of credibility if it just stuck to evidence-based, data-driven policies like they talk about when it comes to climate change. A simple example would be to state how many cases of COVID have been transmitted in dining restaurants and provide a target as to where that number needs to get down to in order to open these businesses back up. The problem is really quite simple. Our provincial government either has the data or it doesn't. If it has the data, then why is it not releasing it in its entirety to this public? It's all about transparency. Look, most adults are reasonable people. You give them some basic evidence and show how you're forming your policies, you'll get buy-in. Although you can't keep changing the reasons for these policies as well. Or you don't have the data, which I think is the case here. And then it's really tough to form your policies, so you get what we have today, as I call the I got a feeling approach, and it doesn't work. Look, if this NDP government wants to preserve any level of respect for the millions of frustrated British Columbians like myself, they need to come clean with a simple question. Do you have the data in its entirety or do you not? And then you need to act accordingly and start acting more responsibly than what we've seen with these latest public health order measures. Thanks for tuning in. Please make sure to subscribe to my channel. We'll have more details for you as they unfold.